A very good evening to all of you. Today we are going to do the MCQ challenge for anesthesia. Why anesthesia is important? Some 10 to 15 questions in anesthesia come in NEET PG, and most of them are clinical questions. Some questions are direct questions. Some questions are indirect questions. Some questions are clinical case scenarios. Some questions are on instruments. So overall, anesthesia is an easy subject. We neglect this subject, but don't neglect this subject. Focus on this subject, you will score good marks in anesthesia. So let's move with the first question. All are indications for one lung ventilation. A bronchopleural fistula, massive pleural hemorrhage in one lung, video assisted thoracoscopy, D cardiac surgery. Except, well, that exception is cardiac surgery. One lung ventilation is not required in cardiac surgery. It is required for thoracic surgery and for lung separation. Now, one lung ventilation or lung isolation is frequently employed for intrathoracic surgical procedures and is also used in situations where the pathology may affect one lung but not the other. Lung isolation may be accomplished by a number of methods, including double lumen endotracheal tubes, placement of a bronchial blocker through single lumen endotracheal tube, and single lumen endobronchial tube. So the correct answer here is D, cardiac surgery. Let's move on to the next question. All are benefits of supraglottic airway device over endotracheal tube, except. So let us see. Endotracheal tube is the best device to prevent aspiration. There is an increased risk incidence of aspiration of gastric contents with laryngeal mask airway, that is supraglottic airway. The laryngeal mask airway is a supraglottic airway device which sits in the hypopharynx and protects the larynx from pharyngeal secretion but not gastric regurgitation. The advantages are that it is easy and rapid, less invasive, better hemodynamic stability, very useful in difficult intubations, less tooth and laryngeal trauma, does not require muscle relaxation, does not require neck mobility. The disadvantage is increased risk of gastrointestinal aspiration. It is less safe in prone or jackknife positions. It is a less secure airway. There is a greater risk of gas leak and pollution, can cause gastrointestinal. Now let us look at the options. A, it is less invasive. It causes less hemodynamic alteration. It prevents aspiration. It requires less time for insertion. So except is it prevents aspiration. In fact, it can cause aspiration. The most frequently reported malfunction in medical gas pipeline system is A, inadequate pressure, B, cross connection, C, excessive pressure, D, alarm dysfunction. It is inadequate pressure. Some of the problems of pipeline problems are inadequate pressure, most commonly reported, damage during construction projects, fire, theft of N2O tanks, this can occur, environmental, sometimes earthquake, lightning, recently it occurred in Myanmar, depletion of central supply, human error, accidental closure of shut-off valves, obstruction, kinking can occur. It is a tube, so kinking can occur, leak can occur. Sometimes obstruction of hose or contamination can occur. So the correct answer here is A, inadequate. Color of shoulder of oxygen cylinder is A, white, B, black, C, blue, D, yellow. It is white. Massive transfusion of stored blood results in A, citric acid toxicity, B, hypokalemia, C, metabolic acidosis, D, hypercalcemia, citric acid toxicity. Gene for ryanodine receptor mutation which responsible for malignant hyperthermia is located on which chromosome? A, chromosome 19, B, chromosome 17, C, chromosome 18, D, chromosome 16. It is chromosome 19. First sign of accidental intraarterial injection of drug is A, pain, B, pallor, C, cyanosis, D, what? It is pallor. Please click the link in the description box to join the ultimate NEET PG breakthrough blueprint class. It is a 2-day class which will be held on Thursday, Friday, and it will be very beneficial for you. You will go to the next level in your preparation. See, most of us don't have the time for studying if you are doing the job or doing something like that. So in such cases, such revisions, such classes help you a lot. And some of you must be doing internship, some of must be studying like anything. for other exams. Some of you may have other commitments, job commitments. So revision will be very difficult for you. So once you do the revision, it will be very beneficial for you. Let's move to the next question. Highest concentration of oxygen is delivered through A. Nasal canal, B. Venturi mask, C. Bag and mask, D. Mask with reservoir. It is bag and mask. 20-year-old man was running on the road. He suddenly collapsed. First thing to do is A. Check pulse, B. Chest compression, C. Call for help, D. Scene safety. It is scene safety. First look that the scene is safe. Then only do other things. A patient with stable atrial fibrillation, what treatment should be started? IV ibutylate, immediate cardioversion, amiodarone, sotalol. It is IV ibutylate. Patient is in atrial fibrillation, but her hemodynamic status is normal. So treatment of choice is IV ibutylate. Where should you attempt to perform a pulse check in a child who is anywhere from 1 year to puberty? It is carotid or femoral. Depth of anesthesia can be best assessed by A. Pulse oximeter, B. Antidal PCO, C. ABG analysis, D. Bispectral index. It is bispectral index. Most commonly used nerve for neuromuscular monitoring and anesthesia is A. Radial, B. Ulnar, C. Glossopharyngeal, D. Vagus. It is ulnar nerve, which is used for monitoring. Best site for core temperature monitoring during malignant hyperthermia is A. Oral, B. Esophagus, C. Axillary, D. Rectal. It is esophagus. Please click the link in the description box to join the ultimate Neet PG Breakthrough Blueprint Masterclass. It covers all the 90 subjects in a holistic manner in just 2 days. The following are methods of invasive cardiac monitoring: radial artery cannulation, pulmonary artery catheterization, C. Transesophageal echocardiography, transthoracic echocardiography, except is transthoracic echocardiography. Transthoracic echocardiography is a minimally invasive form of cardiovascular monitoring. Other options: transesophageal echocardiography is an invasive procedure. Pulmonary artery catheterization, of course, is an invasive. Ashner reflex is seen in A. Cardiac surgery, B. Neurosurgery, C. Spinal anesthesia, D. Squint surgery. It is seen in oculocardiac reflex seen in squint surgery. All are indication of evoked potential monitoring except A. Cerebral tumor resection, B. brachial plexus repair, C. mastoid surgery. C. mastoid surgery. A heavy smoker when posted for electric surgery should be benefited if he stops smoking 3 to 4 days, 1 to 2 weeks, 6 to 8 weeks. It is 6 to 8 weeks before surgery. During pulmonary artery catheterization, entry into pulmonary is denoted by increase in systolic pressure, decrease in systolic pressure, increase in diastolic pressure. It is increase in diastolic pressure. Most common complication of pulmonary artery catheterization is infection, thromboembolism, arrhythmia, pulmonary arteritis, arrhythmia. Which among the following is the best monitor to detect abnormal hemoglobin? A. Pulse oximeter, B. Carboxyoximeter, capnography. It is spirum, carboxyoximeter. Plasma cholesterol is reduced in all of the following conditions: A. Pregnancy, liver disease, malnutrition, hemodialysis, except hemodialysis. Which of the following is not a complication of success in choline? Increased IOP, increased ICP, increased BP, it is increased BP. Water content of soda lime is A 0%, 5%, 10%, 15%. It is 15%. I wish you all the best in your preparation for the NEET PG.